According to the American Academy of Pediatrics, cases of kids under the age of 6 ingesting edibles with THC have increased by more than 1,300% since 2017. The same study found that 97% of kids found the edibles at home. So this has a lot of parents talking. They want to know what they need to know. We're joined live by Dr. Priscilla Hanudel. She's the Assistant Chief of Emergency Medicine at Kaiser Permanente South Bay. Thank you so much for being with us this morning.
Thank you.
You know, we look at the numbers. The numbers truly are shocking when you break them down. What have you seen in the emergency room yourself?
Yeah, so there's a lot of edibles being found at home. And the reason it's dangerous is because edibles are actually very highly concentrated with THC. So a little bit goes a long way in these kids. And in very severe cases, especially in the ER, we might see kids who are very drowsy, excessively sleepy. They might be having trouble breathing, and that's what we're going to be supporting with either ventilators in extreme cases or maybe oxygen in some milder cases. But at home, you also might see some kind of early clues that are a little bit milder. Kids might have a loss of coordination. In little ones, they might have difficulty eating, using utensils, grabbing their finger foods with their hands. They might look like they're back to toddler stage when they're walking, just unsteadiness on their feet, or difficulty playing with their toys, anything that just looks a little bit off. And then in some older kids, they might be very anxious or just have some odd things that they're saying. And those are good times to call the poison control center.
I think that's really fascinating, actually, things that parents probably wouldn't think about. You're also, you know, when you look at the age here, 6 years old, when should parents be talking about kids and the dangers of edibles? Sometimes I think parents worry it's too young to talk about some of these things, or maybe the kids have already experimented.
Yeah, no, that's a good thought. You know, parents fear that I'm a mom, so I fear that myself. But I think it's just really never too early. We're used to telling kids not to do things from a very, very young age, like don't touch something hot, don't eat something, you know, don't take food from strangers. But now we're just going to have to go more broadly. Don't eat anything really that looks like food or candy unless mom or dad, grandma, any caretaker gives it to you. Make sure you ask permission if you're at a friend's house before you eat anything. Really talk to an adult anytime you want to eat any food or candy, because these edibles can be very deceiving.
Well, and they look like candy. I mean, they are legal
Absolutely.
too in a lot of cases. You know, parents go out, they buy these for themselves at home. What are some ways to safely store them if somebody has gone out and bought these?
Yeah, so you want to really just keep them far away from kids. If you can put them in a very tall or high cabinet, that would be great. If you can lock the cabinet, that's even better. And then really just honestly hiding them, especially if you have more curious aged adolescents who might be looking for things in the house. The best, any way that you can hide it is great. And if these are like medicinal use marijuana, then you can also make sure you keep it in the child resistant container that you originally get them in. But yeah, basically locking up cabinets the way you would do with liquor or firearms, because these can be very poisonous substances.
Yeah, I think there's a misconception, right? Because they are legal, but there's a big difference between, you know, a 5 milligram gummy and maybe a 100 milligram chocolate bar.
Yeah, exactly right. And as anyone who has used edibles knows, or from what you hear, there's a very delayed onset. So kids really just may not notice what they're doing. If something tastes good, they're just going to keep eating it. And then that level in their blood is going to add up and just get to them very, significantly affect them once it hits them. And at that point, it's too late.
All right, Dr. Priscilla Hanudel, thank you so much for being with us this morning. We appreciate it.
Thank you. Thank you so much.